Tuesday. Happy Tuesday.
Happy Tuesday.
hmm Yes, how are you?
I'm good. How about you?
Oh, me too. I feel okay today. Thank you so much for asking. Yes, at least. Oh, Merry Christmas in advance.
Merry Christmas. Yes, right. Actually, today is the first day of December.
All
So,
right.
yeah, Christmas is coming.
Correct. Yeah, that's why. Actually, I forgot. One of my students just mentioned happy first day of December. And I said, "Oh, really? Oh, yes. It is December 1." Yes.
Yes.
All right. How's the situation of coronavirus in your area? Getting better?
It's just so-so. Every
Um,
day, yeah, new patients number is almost 400 to 500, even though
mm,
government is trying to reduce the number.
I
But
see. So it's still not good.
yeah, still situation is not very good.
I see. But I heard it's decreasing.
Not so. Yeah,
Okay, right. And I really hope that it will get better as
yes.
days pass by. Okay. Well, then, do you have anything else to share with me?
No, nothing.
Okay. What's the article for today's class?
The number 1390.
1390.
Yeah,
Bacteria.
bacteria.
Oh, why is this so? Okay. Could you please tell me something about this?
Yeah. Implants coated in bacteria could be used during bone fracture surgery to help speed healing and prevent post-operative infections.
Mm-hmm.
When someone suffers a fracture, surgery is sometimes needed to have it made correctly. A common technique is to use a metal implant to help broken bones stay aligned while healing. The bone fuses to the metal as it mended. Later, at Hubei University in Wuhan, China, and his colleagues tested whether coating an implant in the bacterium Lactobacillus casei, which is found in yogurt, could improve recovery.
Mm-hmm.
This species is known to regulate the immune environment, which could support tissue generation and
Mm-hmm.
to release antibacterial substance. To do this, the researchers gave titanium implants to rats with broken tibials. Three of the rats received stent implants, and three had implants coated in dead Alkansas bacteria. After 4 weeks, the team found there was a 27% increase in bone tissues in the rats with the bacteria-coated implants compared with a 16% increase in rats with regular implants. An increase in bone tissue is a sign that the fracture is healing. One potential risk of implant implants is infection at the site where the implants meet the bone. So the team also tested their LKSA-treated implants was more resilient to infection by coating in multi-drug resistant MRSA bacteria, which can cause infections. After 12 hours, the researchers found that 99.9% of these path- pathogens were dead. Bacteria played an important role in the gut microbiome, and there is increasing evidence to suggest that their benefits can be harnessed outside the course too. He met
Mhm.
Wook Chang at the National University of Singapore. Sure,
Mhm. All right. Resilient.
resilient
Yes,
and
and microbiome.
microbiome.
Yes. All right. Any questions about the vocabulary?
Everything is okay.
All right. Well, then let's move on. What is the common method used when someone suffers from a fracture?
Mm, Okay.
Mhm.
Implants coated in bacteria could be used during bone fracture surgery to help speed healing and prevent post-operative infections.
I see, right. And what was the test done in Hubei University in Wuhan by Lei Tan and his colleagues?
Okay. Leighton at Hubei University in Wuhan, China, and his colleagues tested whether
Mhm.
coating implants in the bacterium Lactobacillus casei, which is found in yogurt, could improve recovery.
Mhm. Isn't it Hubei, Wuhan is where the coronavirus came from?
Yes, right. The
Oh,
Wuhan city.
I
It's the same
see.
city.
Honestly, it sounds so
It's
familiar to
the,
me.
yes, right. Origin of the COVID-19.
Right, okay. Yes, and how did they perform the said test?
Okay.
Mhm.
Okay. They to do this, the researchers gave titanium implants to rats with broken Thai bias. Three of rats received standard implants, and three had implants coated in dead LKC bacteria.
Right. Yeah, so that is how they proceed. Yes,
Yeah,
with the project. Okay, it's tibia. Tibias.
tibias. Okay.
Right. Okay. And have you or someone you know ever suffered from a fracture before?
Oh, yes, right. Mm, when I
You?
served yeah, the
Oh.
army,
Oh.
actually, I played basketball with my colleagues, and
Uh-huh.
then accidentally someone hit my nose with his shoulder, and then it broke my nose bone.
Mm, I see. Oh no.
Yes,
So did
right.
you have a
Actually,
surgery? Mm-hmm.
yes, right. I got surgery. Actually, so once your nose broken, then the bone should be um, mended
Mm-hmm.
quickly. Without that, then your bones um, could be uh, could looks not straight. It could be crooked.
Oh, really?
So yes, right. So I got
Mm.
surgery, but there is no anesthetic or anything to
Oh.
relieve pain.
Oh my gosh. Why not? Inside the military, you mean?
Yeah, inside the military.
Ah.
So I got surgery without any anesthesia.
Yeah. Why is that so? I think that seems so cruel, having a surgery without any anesthesia.
Yeah, but actually, I don't know why at the time um, the surgeon at the army he didn't have anything, and then he told me you
Oh.
can just yeah endure or
Oh my
bear the
gosh.
time. So that was really painful, but actually
Mhm.
the surgery was very successful. So now my nose is
Mm.
not mm, weird.
So that means you can actually shake, shake,
Yeah, yeah,
shake, go up, up.
yeah,
Ah, it's not
yeah,
a
no problem.
problem.
But yeah,
Mm.
I still have some point on here. It was
Ah, this
broken,
part.
both sides of the bone.
So how did they have the surgery? They cut here?
No, inside the nose hole,
Oh.
they put some kind of a stick and then make it
Mm.
straight.
Wow.
Yeah,
Yes, right. Ah, that's really painful,
yeah,
right?
right.
Yes. Actually, one of my friend who is a doctor suggested me to have nose lift because my nose is not so good.
Yeah.
But when I asked how they do it, they say they will insert something. So I said, "Oh, oh no, 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 no. I couldn't. It's okay,
Yeah.
right?" Yes. Okay. And do you think this study will be helpful in medical field?
Oh, yes, right. If
Mm-hmm.
this study is successful, then lots of people who are suffered from a fracture
Mm-hmm.
get some benefits. They will
Mm-hmm.
recover faster than before.
Mm-hmm. Right. Yes. Do you have this kind of system? How do doctors treat fracture in Korea?
They say um, they use some kind of a screw and then metal yeah,
Ah.
to make the fracture, broken bone uh,
Mhm.
stay. They use some screw.
I see. To connect or to
Yes,
fix.
right. Yeah.
I see. Right. Because if it is, I think two words. Cement. Is it cement?
Cement. Actually, that's not a cement. That's a kind of
What's that?
yeah. It's a kind of something. Yeah, looks like cement.
Cement, right?
Yes, right.
Yes. Ah, to connect the
But
bone.
yeah, we call that um band or weight. I don't know.
Yeah, me
Yeah.
too. Yes, I'm not so familiar with medical terms. Yes, I just heard that it looks like a cement, so I just say cement.
Yeah.
Yes, something like
Yeah.
that. All
Actually,
right.
yeah.
Mm-hmm.
Okay, let me check. Okay.
Mm-hmm.
Yeah, plaster. Yeah.
Plaster.
Yeah, that's a plaster.
It's a kind of plaster,
Yeah, yeah.
right? Yes.
Much lighter than cement.
Ah, okay. Yeah, because cement that is heavy, right?
Yeah,
So yeah, if it is
yeah.
an arm fracture, it would be heavy. As well. Okay. And if there is something that you wish medical experts can discover or invent, what would it be and why?
Mm, I wish medical experts can discover mm, discover the mm, yeah, there are lots of things I want to them to discover. So yeah,
Mhm.
I want them to make a micro robot
Mhm.
or capsule robot.
Capsule
So
robot. What's that?
yeah, once you have some trouble on your stomach or intestine,
Mhm.
then usually they need that kind of a big surgery. They have to cut your belly
Mhm.
and then check your yeah, region.
All
But
right.
if they can remote control the micro robot, then if you just
Mm.
swallow the capsule type robot,
Mhm.
then they can manage it or handle it to cut your stomach area,
Mm.
to cause some tumor or something like that.
I see. So like remote control, and they will just manage inside.
Yes, right.
I see. How can that robot go out from your body?
Yeah, from your intestine, from your yeah,
Ah, so it's like a
it's
poop.
it's like a poop. Yeah,
Aha, okay. So it will just come out naturally.
yeah,
So it's a kind of disposable.
yeah. It should be.
Yeah, of course, because they, yes, right. They will actually, yes, go out from your body. I thought coming out again from the, where will they insert it? Swallow, right? You swallow?
Swallow it. Yeah, just
Ah,
like
okay.
cancer. Yeah,
Yes, I'm thinking, how can that go out? Out again from the mouth? Wow, that must be painful. Yes. Yeah, especially in Korea because I think the problem is stomach
yeah,
cancer, intestine
yeah.
cancer.
Stomach
Common.
cancer is the
Mhm.
number one. Yeah,
Mm.
frequent cancer case in Korea.
Right. That's why you have to have a checkup, like intestine, for at
Yeah,
least every 2 years or 1 year.
yeah. Every other year. Yeah,
Every
actually.
other year. Okay, right. Good. Yes. Any additional things or anything else to add?
No, that's all.
Okay. Wow, interesting. Yes, I really hope that it will be successful, even though it's coming from Wuhan. Yes. Okay. Well, then, thank you so much for discussing this article with me, Tay. Have a good rest.
Okay,
Okay?
bye bye.
Mhm.